Hi, everyone. I'm Maggie McGrath, editor of ForbesWomen. Earlier this week, Vice President Kamala Harris announced that Minnesota Governor Tim Walz will be her running mate. Here to tell us a little bit about Governor Walz's record on reproductive health is Ruth Richardson. She is the president of Planned Parenthood's Minnesota Action Fund, and she joins us here to break down everything we need to know about his record on all things reproductive health. Ruth, thank you so much for joining us.
Absolutely. Thank you for having me.
So let's start broad. You are the president of Planned Parenthood in the Minnesota region. How has Governor Walz used his time in office to legislate on matters of reproductive health?
Governor Walz has been a great champion for reproductive health and reproductive freedom. After the Dobbs decision came down, Minnesota became the first state in the nation to protect access to abortion care with the PRO Act. And I think it was so important that when Governor Walz signed that bill into law, not only did it protect access to abortion care, it also protected the right to carry a pregnancy to term, to protect access to contraception, and access to IVF as well. And so he's been a real trailblazer within that regard. And he didn't stop with just protecting access to abortion care with the PRO Act. He also wanted to ensure for people who were traveling across state lines to get care, that those patients could be protected and doctors could be protected as well. And so signed a bill into law to ensure that they would be protected while they were receiving care, the Reproductive Freedom Defense Act.
Interesting. So when the Dobbs decision overturned Roe v. Wade in 2022, did he call you? Did he call your offices and get feedback on, how to legislate? Or take us back to that time. What was his leadership like in those days and weeks?
After the Dobbs decision, there was quite a bit that was going on because people recognized with the overturning of Roe v. Wade that by cutting off access to abortion care, it didn't just cut off access to abortion, it cut off access to health care. And so there were so many conversations in those days after the Dobbs decision around what was at risk, including increasing maternal mortality rates, infant mortality rates. And the reality is, fast forward, 2 years past that Dobbs decision, everything that was predicted to happen has. We've seen an increase in maternal mortality rate. We've seen increases in infant mortality rates. And what we have also seen is in states that have the most restrictions against abortion, they have the highest rates of maternal mortality and infant mortality. And in Minnesota, we've gone a completely different direction with Governor Walz and his leadership and the leadership of the legislature to ensure that we're protecting those things. And while other states were seeing infant mortality increase, we saw it decrease slightly. Still more work to do, but recognizing the importance of the legislation and the focus on protecting reproductive freedom in Minnesota is having the results that we want to see in those realms.
Interesting. So where we're seeing motherhood mortality and infant mortality rise in states with restriction, Minnesota, you say, is going in a different direction, and you would point to the legislation that Governor Walz passed. Is it specific to the Dobbs decision, or are there other pieces of legislation that he has introduced that have helped mothers and infants in Minnesota?
Yeah, I think it's important when we talk about protecting reproductive freedom, that means protecting access to many things. It means that we're protecting access to cancer screenings, STI treatment, and screenings as well, and also thinking about what it means to be able to carry a pregnancy to term in the best conditions. And so things like the Dignity in Pregnancy and Childbirth Act bill, that's another bill that Governor Walz signed into law to ensure that we're doing work to address the deep disparities that we see with the Black maternal health crisis and the Indigenous maternal health crisis, not only in Minnesota, but understanding that that's something that we are seeing nationwide, and also ensuring that we were protecting access to family planning services and increasing the dollars related to family planning as well. Because again, in states with the most restrictions, we're seeing STI rates skyrocket. And it's really great in Minnesota to know that while we still have work to do, that we're going in the right direction in terms of ensuring that there's access to essential health care.
Interesting. So, as you sit in a position of leadership within Planned Parenthood's organization, how have you seen other governors compare? As you look across the landscape of the country, you mentioned Governor Walz was the first to sign protections in place in Minnesota. Have you had other states calling you for advice, or I don't know, give us a compare and contrast to how other state governors have responded in this environment?
I think Minnesota in many ways has been setting a number of blueprints that other states have been seeing ways that they can attempt to replicate, not only around protecting reproductive options with the PRO Act, but also the Paid Family Medical Leave Act that was signed into law by Governor Walz. That has really been a model that other states have been looking to as well, and recognizing the work that was done around ensuring that families can stay together with the AfricanAmerican Family Preservation Act. There are so many of these bills that were signed into law by Governor Walz that we're talking about today that other states are really seeing as a blueprint for replication.
Can you take us into that last piece of legislation? Because that sounds specific to Minnesota, but I don't know, could we see it on a national platform? So what do we need to know about the African-American Family Preservation Act?
I think it's really important for people to understand that for decades within this country, we have seen Black children and Black families have disproportionate contact with the child welfare system, even when we're looking at situations that are similar situated with their white peers. And so we see this increase of Black children being removed from their homes. And with this bill, the African American Family Preservation Act, it's ensuring that when there's contact with the child welfare system, that there is work to be done to ensure that as a first stop, those children who are removed they'll look for a related family member who can care for those children before removing them outside of their community or outside of their kinship relationships. And I think that is something that has been a challenge here within the United States for a very long time, because we have a long history of family separation that has impacted Black children and Black families.
Now, Ruth, you mentioned that reproductive health obviously means more than just abortion, and part of reproductive health is also IVF. And Governor Walz has a very personal experience with IVF. Can you share a little bit more about what you know about his story?
Yeah, I think it's really important for people to know that when we're talking about reproductive health and how personal this is to individuals, and recognizing that Governor Walz has been very open about his family growing with the support of IVF. And that's one of the reasons that he fights so passionately and fiercely to protect reproductive freedom. Because while others are trying to control other people's reproductive health, he really understands firsthand what it means to be able to have the ability to choose what's best for you and for your family.
How do you think his leadership as governor could translate into leadership as a potential vice president? Obviously, he's not the top of the ticket. That would be Vice President Kamala Harris. But you've witnessed him. You've worked with him as governor. How do you think these policies will translate to national office?
Well, I think with Vice President Harris, she has really shown her commitment to protecting reproductive freedom. She actually made history earlier this year, becoming the first sitting vice president to visit a facility that provides abortion. They visited our St. Paul Planned Parenthood Health Center, and Governor Walz joined Harris on that historic visit. And so I think from the very beginning of sort of the unity of this ticket, there is a shared sentiment and support to protect reproductive freedom. And really, this is the most pro reproductive freedom ticket that we've seen in our lifetime.
Interesting. The most pro reproductive freedom ticket we've heard in our lifetime. And then on the other side, I've also heard the attack that this is the most radical liberal ticket we've seen in our lifetime. Are those two titles perhaps connected?
Well, I think what's most important is when you go to the American people, they overwhelmingly support access to abortion care, and they overwhelmingly support reproductive freedom, regardless of what title they wear. And so I think when we talk about this ticket, I think what we can say is this is the ticket that is most in line with the values of Americans.
Now, obviously, his appointment as running mate is still very new, but you sit as the president of the Planned Parenthood Action Fund for Minnesota. What is your chapter doing? What is the voter engagement that you are perhaps already starting to do?
So this election is the most consequential election of our lifetime, to be sure, as it relates to protecting access to reproductive freedom. And so we're in this space of ensuring that we are helping to get new voters registered, and we're talking to our neighbors because it's important for people to understand not only what is at stake with this election, but also to understand the importance of voting.
What is your plan for the next, I think it's 90 days. We are 90 days out from this election. What will you be doing on a day-to-day basis between now and November?
We're going to be talking to a lot of people between now and November. And I would just say within this space of having Governor Walz on the national ticket, there is so much hope. There's so much joy with Harris and Walz on this ticket. And so I think between now and November, what you'll be seeing is a lot of energy to ensure that we are on a path to truly protecting reproductive freedom in this country.
Ruth Richardson, Planned Parenthood Action Fund Minnesota, thank you so much for joining us and sharing your perspective. I hope you come back and tell us what you continue to see on the ground. But for the meantime, thank you so much.
Thank you.